Welcome to the Protecting Your Nest podcast. When I was a bright-eyed student doctor, literally 28 years ago, I can't believe that it's been that long, you would have thought that most of what I would learn would come from my professors in medical school or my attending doctors who supervised me in the hospitals. And although they absolutely were important in helping me become the doctor I am today, as I reflect, I may have learned just as much from other members of the healthcare team. In fact, when I think about it, it's really those other members that I remember helping me the most. In fact, when I go back to an experience I had at Mount Sinai Hospital in Chicago as a third-year student during my obstetrics rotation, being asked as a new student doctor to immediately glove up and gown up because one of the patients was in labor and delivery and ready to have her baby. There was no time for me to declare out loud, I've never delivered a baby before. But I just hadn't done it. So it really was an interesting moment. But within minutes, I was blessed with the opportunity to deliver my very first baby. And it was a magical moment that I'll never, ever forget. Thankfully, the patient did most of the work, and I was able to enjoy the miracle of life in that moment. She was guided, and I was guided not by a doctor, but by a nurse who artfully walked me, the patient, and her spouse through the entire process. I will never forget that moment, and I'm just so grateful for all the nurses who are basically the foundation of a lot of the work that we're doing in our healthcare systems. And by the way, all the docs were in surgery, which is why I was essentially the last option to help deliver the patient's baby with that wonderful nurse. So that's why I'm so excited to have my partner here, a nurse practitioner in today's podcast, just to help us understand the critical role they play in ensuring that the healthcare you'll need and deserve will be delivered by a well-trained professional. Today's guest is Amanda Decker. Amanda is a nurse practitioner who understands the value of helping her patients achieve metabolic health. She graduated from Vanderbilt School of Nursing in 2005 and has been practicing in primary care just like myself since then. Her Twitter handle is Decker Less Carbs. That's Decker Less Carbs to emphasize her desire to live a carb-restricted lifestyle, and where she states in her Twitter that she is a wife and a mom, and in 2017, she had a change of practice heart, where she stopped chasing diseases and started seeking health. You know, she stated that she would never stop learning, which is likely how she discovered the magic of metabolic health to help heal our patients. She's dedicated to learning, and I knew that for sure because I looked at her profile and I said, oh my God, she's certified in advanced education from the Obesity Medicine Association, is scope certified by the World Obesity Federation, is a LowCarb USA certified clinician, is board certified in ketogenic nutrition specialist by the American Nutrition Association, and is certified in metabolic health practitioners from SMHP, which is amazing because we just started that society and she's already certified with them. So Amanda, it is my absolute pleasure to welcome you to Protecting Your Nest.
Thank you.
Now, before we get started, for those listening to this podcast, Amanda agreed to make a few short videos with me on YouTube. So make sure to check out the YouTube channel so you can see additional tips that Amanda shared during those little YouTube sections. So it was really fun to do that with you. So let's get started. And clearly from your social media comments, you put your family first.
Very
So
much so.
let's begin our conversation by you introducing your family to my listeners.
Yeah. So my husband is Tim. We've been married for, it'll be 19 years this August. Um, we are best friends and partners. Yeah.
I love it. I love it.
We met he was actually my brother's best friend, and that's how we met. And my brother said there was only a couple people in the world that I was allowed to marry, and he was one of them. So it kind of worked out. They are still friends. 19 years into our marriage, they're still friends. But yeah, so I love life and our journey that we have together. And he's given up so much for me to achieve my dreams. And I greatly appreciate that. We're definitely partners. And then we have two kiddos, 11-year-old. I have an 11-year-old son, Griffin, and a 6-year-old daughter named Willow. And they're amazing kids. They are so intuitive. Their brains, they just surprise me. They make me a proud mama. So Griffin is more about family and helping on the farm. He's not really into a lot of athletics and things like that, but he loves Fortnite, and goodness gracious, that Nintendo Switch, we have to hide it sometimes. But so he likes that. Willow is kind of a free spirit. She loves to sing and dance and just be artsy. So they both are coming up with kind of their goals of what they want to be when they get older. Griffin kind of doesn't really know. Willow changes her mind. Sometimes she says she's going to be a nurse like mommy, and then other times she says, I'm going to be an artist and put my stuff in the gallery. Okay, whatever you guys want to do, just go be productive citizens. I don't care what it is. Just be productive and be happy. So yes, my family is great, and I do live on my family farm where my grandmother is there, my parents are there, my brother lives on the farm, I have an uncle that lives there. So my life is very much oriented
Wow.
around my family. So.
I love it. And man, we talk about protecting your nest. Well, you have a nice group of folk in your nest, around your nest, and having different generations to help raise those wonderful kids. And I'm sure we're recording this, by the way, guys, on Easter morning. So for those listening, I'm sure that, for me, my kids are 21 and 23. So we don't do exactly the same activities we did previously, but I'm sure you guys are going to have a wonderful Easter celebration. So thank you for sharing that. I just love learning about families and all of that good stuff. So, but guess what? Dr. Hampton's a city boy and you a farm girl.
Yeah.
And, in my previous life, I would actually do insurance physicals for families with larger policies, which required a doctor's visit, believe it or not. And I remember getting up really early to get to those appointments in rural parts of Illinois. And I know farmers get up early and have to work really hard. So I want you to talk a little bit about what it's like to live on a farm and being in a family that raises cattle.
Yeah. So my farm has looked different over my life, has kind of changed. Thankfully, right now, my parents do 99% of the farming. My dad is semi-retired, and my mom has been a stay-at-home mom since my younger sister was born many years ago. And they've got a great setup going. So they handle most of that. Most of my farming comes in if they're on vacation, because farmers need vacations too. But guess what? Their animals and their crops and their things, they don't take vacations. They're still there. So, when they go out, that's when my family and I really take over as far as making sure we go out and check the cows. So you got to go out once a day and count your herd, make sure none of them are hurt, make sure they're all accounted for. During birthing season, you got to, are the mamas doing okay? Are the baby cows there? Do we need to call a vet? Is there a calf that needs to be pulled? I don't pull calves, but I will call somebody that will pull a calf if it gets stuck in the birth canal. Is their eating environment okay? Is there anything around there that's unsafe? So that's, we fill in when they're not there. Now, when I was younger, my grandfather did have cattle at that time. And then we also raised a garden that just fed our family. And so it was 4th of July morning, getting up at 5 o'clock, 4 o'clock in the morning to go dig the potatoes and, harvest the crops and that kind of thing, and shucking the corn and making sure it was harvested on time and prepping it and, getting there. So I have very vivid memories of, all right, we went to the field with Pop, we pulled off all the ears of corn, we took them down and, husk them and shuck them and that kind of thing. And then watch my mom and my grandmother and my great grandmother prep it for freezing and canning and things of that nature. And so I have some great memories of what proper food production should look like, I should say. Yeah. But as far as, thankfully, my morning routine is more about my kids and getting them ready for school, except for when parents are out of town. And thankfully, too, they've got their setup going for their cattle. So it's all, we have a mule that we can go out and check on, not a mule that I ride, a mule that, it's a drivable mule that's powered by gas. But yeah, it's a good setup.
Right.
Yeah. Yeah.
I like it. You have skill sets I don't have. I definitely know how to get the kids ready for school when they were that age, and I don't have to do that anymore. But what's interesting is I don't have the skill set that I can watch take over for my family. I just go to the grocery store, and I know that's where my animals come from. So just watch, understanding that you have a different perspective is awesome. My wife is different though. She's a country girl in a way.
Mm-hmm.
And, I remember when my wife, her dad, and this is in Mississippi, he sent her some sugar cane. And so I'm looking at my wife and she opens up this package of sugar cane that's wrapped in, he wrapped it in newspaper, right? Yeah. And then she grabs one of the sugar canes and then she takes a knife and she cuts it like she's, I just couldn't, just her aggressive cutting. And then she opens it up and starts sucking on this sugar cane like a wild animal. And I'm looking for the candid camera, like, what just happened here? I knew in that moment that I had married a country girl, and those moments still stick to me. So, but I'm still with her. So, we celebrated a little over 26 years. I think this year will be 27 years. So I totally get it. And so anyway, thank you for giving me a flashback. Anyway, let me move along. As you know, I celebrated nurses in my intro and thought, it would be, I just think that nurses are awesome. And I'm hoping to inspire other nurses who may be listening who haven't really thought about being a nurse practitioner, right? So my question to you is, since everybody's not understanding exactly what that is, could you explain a little bit about what exactly a nurse practitioner is and also what's the process to become one?
Yeah. And Tony, I hope that people or the other nurses do consider looking at nurse practitioner school because we do have such a shortage of primary care physicians in the country and primary care providers as a whole. And so we need more to take care of our population in the years to come. So nurse practitioners, and it varies state by state because each of us have different governing bodies. But the process to become a nurse practitioner, there's basically kind of two routes. You could be an RN first, and you can work for a while, and then you can enter into a nurse practitioner program, which is generally between a 3 and 4 semester program if you were already an RN beforehand. Very intense semesters, I should say. Now, if you're not a nurse beforehand, but you have a bachelor's degree, there are several programs that do these bridge options to where you go and you basically do a very intensive RN program for the first 3 semesters, and then you do the NP program on the back side of that. And both options are very good. There's options both directions. So when you're looking at it in an NP, one of the main differences between our education and, say, the traditional medical education is that we decide what we want to specialize in before we go into our program. So when you went through your training, you had residency or you had rotations and things like that where you got experience to everything. Not so much. Everything. I decided in the beginning that I wanted to be primary care family medicine, and all of my training was dedicated towards that. If you want to be a midwife or women's health, all of your training is dedicated towards that, or ER or whatnot. So you decide which avenue you want to go before you even get into training, and then that's kind of what you're stuck with for the most part. And after you get out, whether the type of role you have is dependent on your state. Most states require us to have a collaborative agreement with a supervising physician. My state, Tennessee, allows me to work independently, and I can pay a supervising physician to be there if I have questions, to sign off on charts, to collaborate with when I'm not so sure about different cases. Other states require much closer contact with the physician, and you're basically an extension of that physician. So you're working for that physician in their practice, and you're extending that role. In Tennessee, I basically am my own practice. I have my own patients. They're not patients of my physician. I follow them from start to finish, that type of thing. But NPs are very confusing, not just for healthcare providers. They're also very confusing for patients. I get patients all the time. They're like, so when are you going back and becoming a doc? That's what I'm like, well, I'm not going to. I'm doing exactly what I want to do. I want to see patients in the clinic. I don't want to be in the hospital. This is what I want to do, practicing in primary care. Not to mention is they make me start all over. I would have to start day one. They would not give me any credit for my 15 years of practice where I'm actively seeing patients, prescribing medicines, getting people healthier now. So there's no point in me starting over at this point. And I don't necessarily even see it as starting over because I have the career that I want and I'm doing what I want and I'm helping people. But so a nurse practitioner, depending on the state, you may be an extension or you may be a solo person on your own. The training is basically RN, pick your path, and then get focused on that one path. So.
That's awesome. I remember going back to my crazy story at Mount Sinai. Once I finally got into my, after training stage, a lot of the people I worked with in the hospital also were midwives, and they had a completely different approach. Mm-hmm. They were doing water births, all kinds of fun stuff, and it was and literally you couldn't ask a doctor how to do it. They knew how to do it, and they were killing it. So it was just fun to have clinicians who bring a certain kind of different twist to the whole experience. So, man, I'm having a lot of flashbacks just talking to you. And in our clinic, we have 3 nurse practitioners in primary care. We have some in our other specialties. I'm in a 50 multi-specialty practice within my clinical site. So, but they really help drive business for us and do a good job. So thanks for that. And so I wanted to go a little bit into the whole benefits of the dietary approach. I mentioned that on Twitter, you're kind of like, clearly stating in your handle, your hook, that you're carb restricting, and so you're doing a ketogenic diet. So many people that we talk to in this space have personally benefited from a ketogenic or low carb diet. I want to hear your story. What kind of things have improved as you've adopted that type of way of eating?
Yeah. So when I first started getting into a carb restricted diet, I didn't even really know I was getting into it at the time. In fact, it's possible it kind of just happened. I did have some childhood obesity issues that I dealt with. And as a young adult, I kind of got that under control through calorie restriction. But then as I moved into, I'm not going to say, when I moved into my later 20s, early 30s, it wasn't as easy, especially after having my child, my 11-year-old. I was finding myself struggling more with my weight again. And so I kind of intuitively just sat back and I was like, all right, I'm restricting calories and I'm starving and I keep yo-yoing back and forth and I'm not getting anywhere. I got to do something different. So it's like, I've always heard from my grandmother, from great-grandmothers, well, maybe you shouldn't eat those starches. If you don't want to get fat, if you don't want to be around the waist, then maybe we should cut the biscuits and the bread and the stuff like that. It's like, okay, I'm just going to cut out all the grains. I'm going to cut the grains. I'm going to eat just mainly whole foods, get rid of packaged items, and eat my meat and my kind of my veggies. And it worked. And I got fairly healthy. I lost the 40 pounds that I was holding on to after that child. I mean, 4 years after having that child, I was still holding on to 40 pounds, and it came off pretty seamlessly. And I was able to add exercise and things back into my life. And I was definitely a much healthier mama when I had my 6-year-old than I was when I had my 11-year-old. And you can see that in their health and their body composition, which is kind of scary that, man, what I did to my kids when they were in utero. But after the whole weight thing, there was more than that. I've had psoriasis. I've had psoriasis since I was 5. So I've had it for 35 years now because I am proudly 40 years old and don't look like it, but that's okay. So I decided in my low carb journey, I cut all the grains at first, but then some of the lower carb grains got meshed back in. So when I lost that 40 pounds, my total carb amount wasn't necessarily ketogenic anymore. So I could liberalize it up a little bit. And I was, closer to that 60 to 80. I might have days where I bounce down lower and then days when I'm a little bit higher. But my psoriasis it was all throughout my scalp, on my arms, on my legs. As a female, you're very self-conscious. I guess anybody would be self-conscious, but especially as a female wearing shorts or dresses or things like that, it was embarrassing. And so it's like, I really want to get rid of this. And I went on pharmaceuticals to get rid of it. And these pharmaceuticals lower your response to illnesses. So it decreases your immune system, basically. Because I'm talking not just topical steroids, which some people can get away with if you've got small amounts, but this is something that I took to Stelara, basically, which is a drug that suppresses the immune system. The response to the psoriasis is an autoimmune type condition. But then when COVID started getting around, it's like, in healthcare, I don't really need to be on something that lowers my immune system. I need to have a good and robust immune system. So I was like, I'm going to go completely grain free. I'm going to go back to my keto roots. I'm going to take the carbs really low, get my inflammation as low as I can. I'm going to go 100% grain free, 100% sugar free, and come off the pharmaceuticals. And I did. And the psoriasis hasn't returned. When I have a high stress moment, so if I've got a big stressor going on, I might get a single little patch that flares up. And I have also even restricted further because I could tell that the spots where I had the psoriasis will still itch from time to time. So I've been going through dietary type things to try to figure out, all right, is there something I can do? Is there something I'm doing that's triggering this other than stress? So I actually went carnivore for a little while and took it down to the bare bones and all right, this is my elimination diet. And so I did meat only for a little while and all my itching went away. And so I'm now kind of slowly adding back in. I've got avocado and lettuce back and they're good so far. I don't have any itching with that, but I did notice that peanuts. So I was making my daughter's peanut butter and jelly sandwich with her low carb bread that I gave her for her lunch. And then I licked the spoon, not even thinking. I was like, I'm in the middle of carnivore and I just licked the spoon from the peanut butter. 5 minutes later, no joke, my elbows are itching. I'm like, what the crap? I really like peanut butter. I want it back. No peanut butter for me. Sorry.
Wow.
So food is definitely medicine, or it is also not medicine. It can also be the root of all evil at the same time.
I'm sitting here and absorbing this, and my story is not as dramatic, but I love peanuts. However, they irritate my stomach.
Yeah.
I mean, so what do? You love something, but it's not good for you. So the other problem I have with peanuts, which I love, is if they're salted, I can't stop eating them. I mean, so for anybody listening, you have to listen to your body. And there's plenty of other things that you love that don't harm you. Mm-hmm. Eat those things and avoid the things that do. And if you have a cheat day, that's fine. So that's one thing. Another thing I like about your comments is that if you become metabolically healthy, then you can maybe do a few other things, that you hadn't been doing. Another thing I like about your comments, which is hard for people to hear, and that's why I'll be putting out a video with Nina Teicholz talking about the dietary guidelines that says eat all these grains, eat all these grains, eat all these grains. Well, if the grains are making me sick, why are you telling me to eat all the grains? So you listen to your body, and your body said you don't want the grain. So I think that's key. So now we're avoiding peanuts for those who need to. And again, for most people, they can tolerate that. Me and you, we need to stay away. Within, and that's something I remember the Black carnivore 8A Fox talked about how she has the same experience. She'll cheat, and then like within minutes, she'll feel not so great. So for those who think carnivore is crazy, it's probably crazier not to try it if you're having these problems. So at least experiment with it. You don't have to go all the way. You should probably do an experiment N of one and try it. I also want to remind people that I did interview Dr. Kristen Bear, who was once in Chicago and left and went to San Diego. And what I want to say about her is that she suffered from, I consider psoriasis like an autoimmune condition. I consider Dr. Kristen Bear had lupus. She went carnivore, and then basically it suppressed it. So you don't get rid of it, but you certainly put it to sleep, and that's all we care about. I had a patient, Monique Travis, on who didn't go carnivore. She just went keto, and she has Sjogren's, which is another autoimmune condition. She was given methotrexate or something like that, or hydroxychloroquine. I can't remember which one. And she never took it because she felt wonderful within weeks. So for those who are listening and you want to be metabolically healthy, this stuff works. It's not like a hocus pocus. It really does work. So I just wanted to emphasize that. So anyway, my personal journey led to resolution of irritable bowel symptoms. And also I had some discomfort in my hands, probably early arthritis that got better. So when you think about your other patients that you're serving, what type of medical conditions have you found that have benefited them, by them doing this approach? What type of medical conditions are just getting better with this dietary approach?
Yeah. So one, I see all gut conditions getting better. IBS, Crohn's, ulcerative colitis. I have one patient that comes to mind that she had psoriatic arthritis, Crohn's disease, and her husband actually had diabetes. And she was miserable. She came to the office and was like, you're miserable. You're on like 4 drugs. Why don't we just try it? What do you got to lose at this point? You're a young lady. We're similar ages. I'm like, at this point, what do you got to lose? So why don't you give me 30 days? Give me 30 days and tell me if you feel better. And she came back in. She was off of 2 of her medicines. She had much less joint pain. Her gut felt the best that it had felt in years. And her husband was off of his diabetes medicine. I was like, she's like, I'm doing this. Life is so much better this way. I also I have one patient in particular that he has MS, which MS is kind of an autoimmune and neurological condition altogether. And we know that low carb and keto works for neurological conditions because it was originally used to control seizures, specifically in kids, before we had anti-seizure therapies that were approved for them to take. And so we're now looking at, all right, can we use ketogenic diets to explore and help other conditions in the neurological realm? Because we know it helps with seizures, and we're obviously seeing it help with autoimmune conditions. So it's like, what do you got to lose? Your doc has tried you on every medicine. He's telling you you're about to start chemo to try to suppress your MS, to suppress the symptoms. Like, give it a try. He didn't go all the way. He tested the waters. He went really low carb with a little cheat here and there. But he's like, within 2 weeks, he said, I can walk across my yard and I'm not shaking. Like, hey, I'll take it. It's like, can you please keep it going? Can you please keep it going and just see how far you can go with that?
That's right.
I see migraines greatly improving, which that's still along that neurological pathway. And whether some of that is foods that are triggering migraines are getting removed, or if it is the fact that the brain works really well off of ketones. So the brain can burn either glucose or it can burn ketones. And when we become insulin resistant, the brain has probably become insulin resistant before the rest of our body has become insulin resistant. And so you're giving it ketones, and now maybe it's got a fuel and it's waking back up. We're exploring it with Alzheimer's. You can I believe it is Amy Berger that has a whole lot of
That's
work
right.
about Alzheimer's, and especially if you catch it early on and the dementia type changes, can we wake the brain back up a little bit? Can we delay progression? Can we cure it? I mean, those are a whole lot of questions that we don't know. That we're definitely seeing that. One of my favorite populations to work with carb restriction is women who deal with PCOS or polycystic ovarian syndrome, which is there again, insulin resistance kind of at the base of it, the heart of it. But I've had multiple patients who we go on a low carb diet, we go strict. With this recommend, I say strict in the beginning, and then when we get to a better place, we can liberalize up. But for you, I want to get you strict. I want to get your insulin down, and I want to get your ovaries working again. And sometimes it works a little too well, and they come back a couple months later and they're pregnant. It's like, oh, wait, you've been trying for 5 years and nothing has happened, and all of a sudden you've gotten pregnant. Now, that's not everybody across the board doesn't respond that way, but a lot do. And so let's see, what else am I noticing? Well, one of the avenues that I'm excited to start looking into more is augmenting cancer therapies. And so there's research and groups that are
Mm.
looking at using fasting and ketogenic diets to augment chemotherapy to make the body not respond as harshly. And they're seeing less weight loss, less hair loss, less nausea, which is a huge one, to not feel as sick after the treatments. Not to mention too, cancer as a metabolic disease, looking at it that way of that cancer is fed from sugar, or many cancers are fed from sugar. So
That's
when we
right.
switch that body's fuel source, you're not feeding your cancer. The one that comes to mind that I think has the most promising in my mind right now is the glioblastomas, which is a death sentence, essentially, when you get that. It's a very highly aggressive brain cancer, and it is highly responsive to glucose. And there are little case studies or little case N of ones out there that went keto, and either their glio is shrinking or their glio is not growing and they're stable way past when they were told was their option to live. So it's very exciting. But I'd say the big ones I see: gut things, neurological things, and then insulin resistant processes like PCOS and diabetes are the main ones that I see and the main ones that I treat in my clinic.
I was fortunate to listen to a grand rounds by the Society of Metabolic Health Practitioners just yesterday, and
Yeah.
a wonderful OB-GYN did a presentation, and she linked metabolic disease to fibroids and uterine cancer. I mean, imagine where we'll be in 10, 15 years as we find all of these connections. And it reminded me that as a clinician, I need to think beyond polycystic ovarian disease. So if we can really get better with this, and then, as you said, what do we have to lose? Eating animals and vegetables that's not a big deal. Get rid of the starch and sugar. Try the experiment N of one. And if you're fortunate to be one of the many people who benefit from this, you really can't lose. And I want to also go piggyback to what you said about migraine. So when I mentioned Dr. Kristen Bear and Monique Travis, they both mentioned migraines. Now, these are things that got better without them having to focus in that area. I think they were looking for other benefits. And then
Mm-hmm.
all of a sudden, my migraines are better. My reflux is better. All of these things got better. And it's like, they look at you like you're a god. And I'm like, no, I'm not a god. I just recommended something that you decided to do.
Yeah.
And for all the clinicians out there who are still on the fence, I sometimes recommend 23 studies by Healthline. So if you search that on Google, it'll compare low carb to low fat, evidence based, randomized controlled trial. And you mentioned earlier how some things are association, correlation. Well, these studies show causation.
Mm-hmm.
So look that up, guys, if you're listening and you're still on the fence. But just as importantly, the diet doctor has a free CME.
Mm-hmm.
It's a free CME. So if you're a clinician, do the free CME. And one thing I like about you, Amanda, is that you've done a ton of educational things in this space. If you want more, LowCarb USA, you've done training with them.
Mm-hmm.
Get their training. Nutrition Network has phenomenal, led by the great Professor Tim Noakes. education. And then, of course, the Society of Metabolic Health Practitioners, they're going to continue to educate us. So I just wanted to really emphasize that the information is out there. Some of the studies when I was in obesity school were like 2008, like the A to Z study, the SHI study. Those studies were done years ago, and yet our clinicians are still using outdated science. So I just wanted to emphasize that and just give people a way to get this information. So anyway, let's think about you in a clinical setting, since we're talking to our clinicians as well. What's a typical day? Because sometimes it's difficult to imagine that you can share this word, this wisdom, this healing in these short visits. So how do you manage that so people can get what they need to hear while also honoring you got to pay bills too. So how do you do both?
Yeah, and that's kind of evolved over 15 years in different situations. But I currently see probably anywhere between 20 and 27 patients in a day is my
That's
average
pretty
day.
impressive. Yeah.
I start at 7:45 in the morning with my first patient. And pending one, I will say I have a phenomenal staff. And without my staff and my support people, there's no way I could make this life happen. I mean, oh my goodness, my front desk lady is amazing. She knows my patients as well as I know them. She's like, I cannot put you there next to that person because we'll never get out of this clinic. She knows exactly where to put everybody. My nurse is amazing. The one that rooms my patients, she knows the patients very well, knows exactly what to ask. She gathers so much information from me before I even get in there. And there's many times I go to see a patient. She's like, come here, I got to give you the backstory first. And she's filling me all in on all this. So could not do that without her. I have a triage nurse that after, I've gotten her extra training in low carb. She's actually training right now to be a health coach as well. So that when patients leave, because every time they leave, they come back and have questions. So she is ready and able to answer so that I don't have to stop every time and do that. So shout out to my staff. I could not do what I do without them. And they are worth way more than I pay them. And they better never leave me, that kind of thing. But 20 to 27 patients a day starting at 7:45. And so right now my practice is half primary care, half weight management. So I currently have some patients that are not my primary care patients that I'm working with them on metabolic health, weight management, weight loss. And I have my appointments divided up differently. But when I'm in my primary care visits, so I've got somebody coming in for like hypertension, diabetes, high cholesterol, all this together, we do our initial, tell me how you're doing. Tell me how you're feeling. How are you tolerating your medicines? How's your blood pressure? How's your sugar running? And then in the end, I'm like, I really want you to work and focus on your lifestyle because lifestyle can get rid of all these things and then we can see each other less. And are you interested in talking about that? And some of them are like, nope, just give me my drugs and I want to leave. I'm like, all right, well, when you're ready, I'm here. And that's that short encounter and it's done. I've made sure traditional medicine wise, I've checked their labs and made sure everything's good. If they want to talk about it and I don't have a ton of time, I've got my kind of set handouts that I give them. I'm like, this is the diet that I believe in that is going to help you. This is where I think you should start. Let's go look at the Diet Doctor website. Let's go look at these resources. Here's kind of a handout. And I want you to set up another appointment. We're going to talk specifically about this. And most of my patients, if they're ready to do that lifestyle change, they're there. Now, when it comes to my weight patients, my first initial weight patient is an hour long visit. And you're probably thinking, how do you see 20 to 25 people in a day and get an hour-long weight visit? I book them before lunch and I work through lunch. My staff leaves for lunch and then I'm seeing my patient kind of through my lunch, which is totally okay with me because I'm either eating something small or I'm fasting that day. So it works out, as long as I have about 15 minutes between my morning patient, my last morning patient, my afternoon patient, then I'm good to go. But and then I stay late after work. So most of the time I'm not done, even though my patients are out of my clinic by 5:00, I'm usually here for another hour afterwards, finishing up all the clinical chart, that type things. And thankfully I've got the family support to be able to do that. But yeah, so it's pretty much, I'm nonstop from the moment I walk in the clinic to the moment I walk out of the clinic. But having the resources and having the support staff is the only way that I could make that happen in the day.
Yep. And I want to do a shout out to your team. And I guess I'll do a shout out to my team. I have my clinical staff like you who I feel are phenomenal. We do have a system where we have what we call cyclical workers and periodic workers, but basically, some are helping us room patients. We tend to use medical assistants. And we also have people who are doing referrals and refills and all of that kind of work. So I want to do shout out to the Advocate Aurora team that supports me. But also, I've mentioned in previous podcasts, I have a virtual note taking service. So I do have that little edge. So it does allow for me to have more time because I don't have to write my notes. But I think all of those supports that we have are very critical. I do want to applaud your dedication to taking advantage of your lunch hour and obviously after work. But I will say this, if you had not achieved metabolic health yourself, you couldn't do it.
No.
You would be, and that's why I love fasting and I even fast on a weekend. I just kind of do lunch and dinner as a rule. And some days I just wait till 4 or 5 to have lunch and because I'm not hungry. When you do keto, low carb, carnivore, a lot of times you're not hungry. So, and then the last comment I'll make is I appreciate the fact that you don't try to force feed people. You don't try to fix people. Rather, it's your family or your patients. You have to let people come when they're ready. And so even as I think about celebrating Easter, which is the day we recorded this, I don't go to my mom's house and try to make them do anything. They know what I do. They know what value. And then, you'll get people that'll come over and start asking you questions. So I let them come to me. And you have to let people do it when they're ready. So I think that's a great approach. It sounds like, I'm talking to myself, talking to you. So maybe we've been trained the same way, but that's exactly what I do. I do want to speak a little bit about, I think I kind of know the answer to this, but I work in a large health system. And a lot of docs and advanced practice clinicians are not necessarily doing what we're doing, but I do have a system that allows me to be who I am. And I really appreciate Advocate Aurora for doing that. So being a nurse practitioner sometimes comes with, again, it sounds like in your environment, you don't have to necessarily be guided as much. You can do your own thing. But have you in the past worked in a system or in a situation where there was any difficulties in using this approach where it would be restricted anywhere? Have you found that hasn't been a problem for you? It may be a state thing, but what's been your experience?
Yeah. Well, I've been at this current job the entire time that I've been using carbohydrate restriction with my patients. And yes, I am very thankful that they let me kind of find my own way and do my own thing. If I'm helping people and I'm productive, that's really all that they care about, and they're seeing the results. I work in a multi-specialty practice group. I think there's over 30 providers in my group. And it's a rural town, but we're the biggest healthcare place in this rural town. And my supervising physician knows that I use low carbohydrate or carbohydrate restriction for my patients. The docs that refer to me, so I have cardiologist and orthopedist and other specialties that refer to me for weight management. And they feel very confident in it because they know that I have the education to monitor the patients. They're seeing the results of the patients. And they also know that if I felt the least little bit like things were going in a negative direction with what I was doing, that we would be changing course and that they're being monitored and protected.
Right.
And so as far as my hands being tied and not feeling free to prescribe them, not necessarily so, except for I have had some of the docs from the local hospital when my patients are admitted for something else, say an infection or who knows, some surgery, an orthopedic surgery. Or I have a patient who had diabetes and has had diabetes for years, and she had a heart attack. She was one of those people that wasn't ready to really work on her lifestyle. She's like, I'll give you a little, but this is what I'm pretty happy with. But she had her first heart attack. And the doc who dismissed her from the hospital or discharged her from the hospital said, now don't let her put you on one of those low carb diets. That's too much fat and it's going to kill you. All right. Lady just had a heart attack from the diet she's doing, which is not low carb. Okay. When do we try something different? When do we change and try something different? And I have other docs that believe that plant-based is the only way to go. And I have nothing against plant-based. I have several patients that are plant-based and they do a carbohydrate
Me
restricted
too.
version of plant-based. I'm like, hey, if it works for you, great. If it works for you, great. But we have to have some common ground of things that we have to remove. But I have some docs that will not refer to me because they think that I will not allow patients to be plant-based. And it's like, come on, no, no, anybody, we're going to do what works for that. And then I have some little comments here and there, just, this person had a flare of this. They're not doing that crazy keto thing, are they? I'm like, well, keto's not a 4-letter word. That's why I like to call it therapeutic carbohydrate restriction now, because it's a wide range of things and it can be very healing. And so I think there's a definite lack of education. Not that they're not very smart individuals. All of the providers in this area are very smart individuals. They just haven't had access or exposure to the same education that I have to see the difference that it can make.
They just haven't had the education, and that's why I tweeted. You probably saw my tweet where I was blessed to collaborate and talk to Gary Tobbs, who wrote Good Calories, Bad Calories, but he also wrote the case for keto,
Mm-hmm.
and we gave that book to all my primary care clinicians because it tells the stories of clinicians like us who have had so much success with this approach. And I will applaud Doug Reynolds with the Society of Metabolic Health Practitioners, but he told me that, and it may have been during our podcast, that Dr. Eric Westman is the one who emphasized metabolic health, right? So part of why we're excited about the Society of Health Practitioners is to take away some of this concern. And because our clinicians are not familiar with keto, and they have not gone to Google and done 23 studies in Healthline and looked at the studies, until they look at the studies, they are going to be afraid. And why are they afraid? As Nina Teicholz would say, is because the guidelines that they're being given are not based on randomized controlled trials. So again, and for those listening, I'm going to certainly, you may want to go back and listen to Nina Teicholz's podcast episode where she talks about this. So I really encourage anybody listening. The information is out there. If you're a clinician, unlike myself and Amanda, who are not in a health system that supports you, then leverage the Society of Metabolic Health Practitioners as a landing place for you to be more comfortable and get around people like us who will then look at Adele Height's guidelines, follow the guidelines, share the guidelines. And if you got to put it in the note, put that you're following these guidelines. And then that way you'll have a little cover. And even Dr. Eric Westman has a video out there, doctors listen up. So if you YouTube that, there'll be a nice video to help people learn these things. And again, we're no smarter than anybody. We were tired of being sick. For me, it was my gut and my hands, and for you, it was the things you shared. And you just got tired of being sick, and then you're like, I'm not sick anymore. I want my patients not to be sick. So it's really an exciting time to be healers and be in healthcare, having this extra knowledge. So I wanted to take a moment and, allow you to share if you can think of some success stories. I think people like to hear success stories. So if you have a patient or two that comes to mind, maybe you can share a couple of examples of patients who really healed with this way of eating.
Yeah. So I'll start with one that it's not the first patient you would think of when you think of carb restriction, but I was working walk-in clinic one weekend because we all take rotations and work at our acute care clinic. So we all share the burden of that. So it was my
Like you
weekend.
have time, right?
Yeah. So, but hey, it makes it a little bit easier since we're all sharing the burden there. It's
That's
not
cool.
every weekend, but I came across this gentleman who was there for foot pain, and he really thought that he broke his foot. And you're like, all right, how does carb work into this? But it ended up not being a fracture or anything. It was gout. He had a gout flare. And, I went back and I looked at his labs and I was like, hey, you're kind of almost in the diabetic range. He's like, yeah, I know. I lost 100 pounds, but I'm just kind of stuck here. I mean, this guy's already lost 100 pounds. He's still almost diabetic. He's got gout. And I was like, hey, and your liver enzymes are really high. They're like 3 times the upper normal. He's like, yeah, I have fatty liver. He's like, but it can't be what I'm eating because I'm vegetarian. I was like, well, what are you eating? And tell me about kind of your history. I mean, take that 5 extra minutes. He goes, well, I've been vegetarian since birth because my parents were vegetarian. So he was raised vegetarian. At this point in his life, he was ovo-pesco. So he would have some dairy sometimes, and he would have some fish sometimes and some eggs. But rarely would he have it. But his daily routine was broccoli for breakfast, beans and rice for lunch, beans and rice for dinner, and that's kind of his pattern over and over again. And it's like, okay, would you be willing to maybe have beans and rice only a couple times a week and maybe increase your other veggies and maybe throw in a little extra eggs and fish just on occasion since you're comfortable eating those? And within 1 month, he had started losing weight again, but within 3 months, he was down 20 pounds. His uric acid had normalized. His liver enzymes had normalized. His insulin levels had normalized, and he was still doing his way of eating. He just had to tweak it a little bit and lay off the beans and rice so much because his body was not in a healthy enough place to where it could handle that amount of total carbs at the time because of the insulin resistance that was there. I have another lady. I just saw her last week for follow-up, and I am stoked about her progress. So she's a mom. She's in her 50s. Early 50s. She works at a bakery creating cakes. So she's a cake decorator. That's her job. Yeah. But when she came to see me, it wasn't even quite a year ago. I think it was June a year ago. And she's like, I'm just tired and I'm sick and, I've got diabetes and I just don't feel well. And I'm just dying. I'm slowly dying and I'm 50. It's like, all right, well, last week at follow-up, she's down 100 pounds and it's not even been a year. She's still decorating cakes. She just does it for other people and makes sure she doesn't partake in them herself. She is outspoken in telling other people, hey, look at what this is doing for me. You can do this too. So I'm so proud of her progress. I have so many other stories. The one who hasn't lost tremendous amount of weight yet, but he's early 60s, has CHF, was on 3 diuretics to control his CHF to not have fluid overload. He got short of breath walking from my lobby to my exam room, which is not a very long walk in my clinic. And he says, something's got to give. I'm dying. I can't breathe. I'm like, yeah, I can tell. You're sitting here and you're huffing and puffing and you can't breathe. He wasn't sure. He was one of those when you first tell him about the diet, he's like, I don't know. I don't know that I can do that. I'm a driver. I eat candy bars on the road. This is, I kind of like food. I'm like, well, I like food too, but I like being healthy. And you're telling me you want to be healthy. So now we have to decide what your priorities are. Shocked me though, because when I saw him for his 2-week visit, just so when I see the person for their first weight visit, they spend an hour and I see them virtually at 2 weeks to kind of check in. At 2 weeks, he's like, I had to stop one of my diuretics because my blood pressure dropped too low. He's like, and I can breathe. I think I might live. It's like, yeah, you might. And then at his 6-week follow-up, he had lost 30 pounds in 6 weeks off all but one of his diuretics. And it's a very mild diuretic. And he's like, I can walk and breathe. And I'm like, all right, this is what makes me keep doing this. This is what keeps me happy. The very last story I'll share with you, and then we can move on to the next one. But a lady in her 70s. I've been her primary care provider for 6 years. She had diabetes, was on long-acting, short-acting insulin and some oral medicines as well. And she, I want to say 7 years ago, had a traumatic brain injury where she had a concussion, and has since that point has had trouble with thought processing, memory, all the things that come along with traumatic brain injury. She even rocks. So if she's sitting there, she's just kind of rocking because of what the traumatic brain injury did. And so at her regular visit, her regular 3-month diabetes visit, she's like, I wish there was something that could make me better. I was like, well, do you want to try keto? You want to try to go low carb? Because here's how it works with your diabetes. And we could probably get you, I don't know if we can get you off of all your medicines in your 70s, but we could get better. And she said, I did keto before I was your provider, before I was your patient, probably 15 or so years ago. And I got off on my insulin then, and I was feeling great, but I went to my doctor at the time and they told me that I had to stop right then or I was going to have a heart attack. I was like, what? You got off all your diabetes medicine. You lost weight. You were feeling good. Your cholesterol wasn't even elevated. And you were told to stop or you were going to have a heart attack. She's like, yeah. It's like, girl, we're going for this. I want you to go. You already know how to do this diet. Just revert back to your ways. Just go do it. So 2 months later, off of all of her insulin, she's only lost 16 pounds. But she said, I can think for the first time since my injury. She goes, I can remember things. I don't have this fogginess in my head. It's like, yes, because you're giving your brain ketones. You have another fuel source that's getting in there. She's like, and my kids even came to me and said, Mom, whatever you're doing, don't stop. Please don't stop, because you're more of our mom than you've been in the last several years. And she's like, and I'm not angry. She goes, after my brain injury, I was snippy and angry. She goes, I'm not angry. She goes, do I ever have to stop or can I do this? I said, girl, you can do it to the day you die. Just keep going. Live well and drop dead one day and don't stop ketoing, because it is making that big of a difference in your life. But it made me think, had she been on keto that whole time, had she been low carb and producing ketones that whole time, would her brain injury have been so bad? We don't know. But
No.
we do know that they're using
more than likely
ketogenic diets for concussion treatment, because your body, the brain uses so much of that sugar right after the injury that your brain is starving literally afterwards. So I don't know, but it's that kind of story that fires me up and makes me want to keep doing what I'm doing every day, because life can be so much better for so many people. Now, is it for every single person on the planet? No, it's not for every single person on the planet.
No.
But when the bulk of our nation is metabolically sick, it can be for the bulk of our nation and make them better.
You are warming my heart today. When I interviewed Doug Reynolds for LowCarb USA, our great leader, him and Pam Devine, I love them for the work they're doing, and with the Society of Metabolic Health Practitioners, he had a brain injury. And he also shared that he feels that the dietary change he made is why he has better mental clarity and better focus. And we need him to have that because he's leading us in this society and with the low carb. So I want to do a shout out to him and his wife and to your patient who recovered. I think about, first of all, shout out to the people making cakes. Because we do need to celebrate sometime. And if we're not, processed food addicted, we're going to get us a piece of cake, So shout out to her and her success. And I think about your patient who was on 3 diuretics, and they all end up with kidney problems because of the medication. And now he is doing well. And guess what? You can still like what you're eating. By not eating a Snickers. I mean, don't bring a Snickers candy bar to my house. I'll probably eat it, right? So shout out to him and the work he's doing. And then I also want to comment on gout. You mentioned gout, your first story. And yes, if you're a gout person, you definitely want to be cautious because ketones and uric acid, which is the gout it will compete. So you sometimes have to work with your doctor to ease into keto. And you may want to stay in keto more than maybe a person that doesn't have that condition. But at the end of the
Want to
day,
go in and
people
out.
do, yeah, they do really well. And you want to get rid of fatty liver quick because vegetarians will eat a lot of pasta, which is vegetarian,
Mm-hmm.
but they have a fatty liver. You just if you do this approach, your fatty liver will probably be the first thing that'll reverse. Now I was adding things up because beans and rice. I mean, I went to school in New Orleans,
Mm-hmm.
and they had a whole lot of beans and rice. And shout out to the New Orleans folk because they had the food to kill you, but it's so good. Shout out to my Southern people. Let me say this. I'm just doing a rough estimate and we're looking at total carbs. We're not going to, beans have fiber, but,
Mm-hmm.
let's just say 24 carbs times two,
Mm-hmm.
maybe 30 carbs, or it's really more than that, but I'm going to say 30 carbs for the rice times two. So I added that up. That was 108 carbs, right? And if you do the math, that's divided by 4, that's 27 teaspoons of sugar
Mm-hmm.
that you're consuming, and then you wonder why you have a fatty liver. So I just really appreciate your guidance and helping your patients to see things through a different lens, and I appreciate the patients for having the courage to say, I'm going to give this a shot. As the theme of the podcast, what you got to lose, right? so
Yeah. Yeah.
so thank you for those stories. Those are really incredible. And I was thinking about, since we've mentioned Low Carb USA a few times, when we first had our kind of pre-podcast discussion, I was literally on the phone with you. I think we were doing kind of a Zoom kind of meeting.
Mm-hmm.
And during that phone call, I get a message on my phone or on a computer, and it said that there was a Low Carb USA article, and guess who it featured? It featured you, which was the universe speaking, I think. So I don't know if the story, I don't know what I didn't read the article yet, but
Mm-hmm.
my question is, in that article, was it one of these stories that was featured, or was it a different story that was featured?
So I think there were two. There was one of those that was featured there.
Mhm.
The only other one that I really talked about during that time was the fact that, I'd had a lady that had worked up the courage to call and make her own weight appointment to start addressing it. And because her cholesterol was a little high, her doctor said, no, you can't go see her. Um, and so she called it like in the middle of the night and left a message. She was so embarrassed. She didn't even want to call during office hours to talk to somebody, called during the middle of the night to cancel that appointment. And so there's still a lot of that kind of stigma out there and re-education that needs to be
Mhm.
happening for sure.
Okay, cool. Um, I want to ask you real quick. I know we'll be wrapping up.
Mm-hmm.
Since we called you a country girl earlier, I want to go back to that. And I know I'm in a more urban environment for sure. And I know you're in the same state with Dr. Kim Berry, and we want to do a shout out to him and his lovely wife and the work they're doing. So is it harder? I mean, to have a community, because I think about New Orleans again. That's not exactly the same kind of environment, but it's in the South, right? And every time I look at the numbers for the South, the highest obesity rates, et cetera. So is it really hard to get that community to embrace this way of eating?
Um, Yes and no. So, there, because at first when I think about implementing low carb and what might be specific to the rural area, I thought, lack of education, lack of resources. But then I was like, that's everywhere. That's not specific to the South, or to rural areas. There's lack of education, lack of resources everywhere. And I was talking to my husband about this last night. It's like, what is it that is different? He's like, it's the food expectations and identity, and almost like your family identity with food. And it's like,
Mhm.
you're so right. It's like, in the South, everything revolves around food. You're supposed to eat a certain way. You're supposed to eat certain things. If you don't eat that way, you're kind of ostracized a little bit. You're no longer asked to go out with your friends. But if you go to family events and mom or grandma has fixed all this food, you're expected to eat that food. And you're expected to eat a lot of that food, and you're expected to eat it till it's gone. And if you don't go back to get seconds, then you've offended somebody. So, and
Right.
that is like this food identity that we have, and all of our meals are not centered around the meat or even the veggie. It's centered around the starch. It's the potato or the mac and the cheese or the biscuits or the whatever it is. It's the starch is the primary thing. And so what's a challenge is getting people to think about food differently, getting them to think about their family interactions differently. When you get together, let's make it about our time that's together and not around the food. And I can give them examples of my own family of when I started down this path and how I ate different. And yeah, I ate the meat, but I brought my own sides kind of thing. And yeah,
Right.
they tried to force feed cake and desserts down my face. And, oh, I made this especially for you. That is the common thing. I made this. This is your favorite cake. It's your special thing since you've been little. I'm like, it is, but that's not good for me anymore. And so I'm not going to eat it. And you hurt their feelings when you do it. But you know what's happened over time? My family's doing low carb with me. My mom, my dad, my sister, my in-laws, they're changing, they're doing, and because they're seeing those health things happen too. And so I think that's what's been the biggest thing in the clinic for me to help the patients. I'm like, look, this happened in my family and this is how it's happening. Maybe you're the agent of change in your family and you're going to make it more, your
Mm-hmm.
family's going to get healthier through what you're doing. And so stay strong and stay focused, and then take that special food that you've loved and turn it into something else. Figure out a way to make it low carb. Maybe it is a net carb product, but that's okay. If it helps you get through that holiday and it helps you still feel like you're participating in the family, then that's what we do. So it's really that food identity, realizing that not everything has to be focused around food. It doesn't have to be focused around starchy food. And you're still the same person you were, whether or not you eat that food or not within your
Right.
family. So, yeah.
That's right. I'm sure my mom will have dressing at her home. Again, this is Easter, guys, for those listening. But my mom knows that she'll have greens, she'll have string beans, she'll have some non-starchy items,
Yeah.
and she won't have potatoes and the string beans, things like that. And normally I didn't do it this holiday, but I know I'll make my mac and cheese cauliflower, right?
Mhm.
So, and I love that. So, and everybody else does too. So, you will coach your family
Mhm.
to help love you well by making these adjustments. So, I really do agree with you that that's what will happen, and you will not be ostracized. And as
Mhm.
you said, you'll still be the same. I remember having some family members who thought if they weren't, because they were drinkers, right? And
Mhm.
they thought that, and they were fun and entertaining. And the question is, would they be that person without drinking alcohol, right?
Mhm.
And the answer is they were.
Mhm.
They were. That's so you don't have to drink alcohol to be that fun, exciting, entertaining person. So we learn through these experiences, and I thank you for that. So let's kind of wrap up with thinking about your personal goals and the upcoming year, and I'll repeat for those who are not aware what the nest and the rope represent, which is the root cause of disease. And we're trying to, keep you from not having metabolic disease. And it requires your diet to be a certain way, is what and when you eat. It requires movement. And that's why we had a podcast episode um, recently talking about exercise. It requires less stress and more sleep. That's why we had a recent podcast episode talking about sleep. How we think, we want to be positive thinkers. We want to avoid trauma, which is what COVID did to all of us. We want to have healthy relationships, which is why Amanda talked about her man. She talked about her husband. In my neighborhood, her husband. We want to avoid organisms like COVID. And there's some healthy organisms, healthy bacteria that's like Bacteroides, which is probably a good one. We want to talk about avoiding pollutants, keep protecting our emotions, and making sure our life experiences serve us. And I certainly think having experience with you today will serve all of us well. So, and these are the life experiences that mold us into who we need to be better. So think about your next year, Amanda, and tell me and my listeners where you want to focus your attention.
Yeah, yeah. So I have two goals. One is kind of more exercise based. So I've always been kind of a more cardio person, and I've not done weights, and I'm very much a weakling. So I'm going to officially do legit push-ups in good form, at least 5 of them by the end of the year. So I'm working on building the muscle. I'm weak. I know, it's all right.
That'll work.
And also I have a goal to run a 5K with my son. So I've done several, and because I enjoy running, but I'm getting him along. And that's something that I want to do as a relationship and an exercise thing is for us to do together. But my big one, if those aren't big enough, is I need to sleep more. I am really bad at resting. I feel like the last 3 years, 4 years, and when I've been kind of exploring my professional growth and education, is I haven't stopped. I haven't slowed down, and my brain hasn't stopped. And so I think sleep is important, and resting and giving my body more of that is something I need to do this year.
Absolutely. Definitely check out that episode with the sleep doctor. The article I wrote with the diet doctors in my low carb corner, prioritizing sleep for health. So you'll see that. So hopefully those things you helped me today. So I'll throw that your way. I keep by my side my little light here.
Yeah.
So I start my day with that. Have my blue light blocking glasses over here on the table. So all those things will help you optimize. And thank you for that. And I definitely think my life is different because I sleep fairly consistently now. So thank you for that. And I think as we wrap up officially, any thoughts on how people can find you on social media, and any final thoughts as we wrap up?
Yeah. So the Twitter is a great place to find me. Like you said, my handle's at Deckerless Carbs. I also have the same tag on Facebook that I run a Facebook page that is just for my weight loss practice. So both of those.
Absolutely. Well, thank you again. I'll do I'm gonna do my cross, because you're, just like I told Doctor, or not Doctor, but 88 Fox, the Black Carnivore. She's a superhero, and so I'm gonna call you a superhero, particularly leading our nurse practitioners and guiding them, and then of course supporting all the work we do in healthcare. So I really appreciate you for being here. I really enjoyed this, and I find that it will add value to those who are listening. So thank you.
Thank you.
So, guys, this was a nice discussion. You heard from a nurse who decided to, take her nursing to a whole new level by becoming a nurse practitioner, and who also understood that in order for her patients to heal, she had to learn how to apply a carb-restricted nutritional approach to her clinical practice. And by learning from great organizations like LowCarb USA and the various obesity medicine groups, as well as the newly formed Society of Metabolic Health Practitioners, she's been able to acquire the tools to guide her and help her guide her patients towards wellness. Hopefully, you were inspired to continue to optimize your health as you listen to her inspiring success stories, and they were inspiring. It definitely inspired me, and maybe, just maybe, there's a nurse listening who has been contemplating becoming a nurse practitioner and just hasn't started the process. So if you are that nurse, I hope Amanda's story will be just a little nudge you've been waiting for to get you on your way. I continue to be honored to share great guests with you each and every week. And I really appreciate all you guys who support me as we journey together to achieve metabolic health. So as we conclude, and again, I thank you, Amanda, again, for being with me. I ask that each of you be safe, be well, and to continue to protect your nest. You have a great rest of the day.
You too.
Thank you.